Welcome to Wired Health. It's our 6th annual event that brings together some amazing innovators in the worlds of healthcare, pharma and technology to look at what the future looks like for health in the age of artificial intelligence, virtual reality, big data and genomics.
We're here at the Crick Institute for Wired Health 2019, bringing people together to really look at some of the exciting technologies and innovations that are going on in this space and trying to solve some of the most important and crucial questions of our time.
It's an interesting event because it's so varied. You know, the topics in the agenda cover everything from cancer research to splunking in the caves through to new technology and innovation.
We are at a place where our consumer technology and amalgamated sensing, the ubiquity of sensors on us, in our environments, and around us is unprecedented. Consumer technology will know more about our mental and physical wellness than many clinical visits.
But what would happen if there were no grants, if there were no fellowships, no funded research projects, no charitable acts, no graduates in medical school, unless the data that you collected was made machine learning ready for the future?
3/4 of humanity lacks access to medical imaging.
We have a blank canvas. We have the opportunity to create something, that we have an example, we learn from it, we make mistakes of course, and we get many things wrong, but it's for us to use that as an example of how healthcare might be reimagined.
Human health, animal health and environmental health are of one and inseparable, and we may need to use this, mindfully use this One Health concept to help fight such complex and interrelated global health threat that we have at hand.
And I really think Wired have got the most breadth and also the depth of new innovation. So I find it really stimulating and exciting to come here every year, and I'm delighted that we're one of Wired's knowledge partners and can help participate in the event.
What's really important is that all our partners are united by the same thing, is that they really want to take their businesses forward by thinking about new and innovative ways of solving real-world problems.
Being able to have conversations with people of all different disciplines, hear their thoughts about what the future of healthcare looks like, what healthcare will look like 10, 20 years from now. It's a really inspiring and really motivating group of people.
Liver is one of those organs that can regenerate. And how many other organs can regenerate? And if we want to look at the very future, we'll be able one day to rebuild, even the laboratory, an entire organ.
Being a Homo sapiens at the top of the food chain is an enormous right. It's an enormous obligation.
How do we take all this innovation and this science to make a difference, whether it's getting it into practice or making a profit, which translates into a tax benefit that I can spend on the public's health.
Yeah.
I don't mind which it is, but we mustn't do the old-fashioned failing of discovering it and letting others reap the advantage.
Once you understand human perception, the fact that its link to objective reality is tenuous at best, what you realize is there's this whole new area for potential intervention which doesn't involve changing the actual objective reality. It simply involves changing the perception. Why aren't painkillers red? Why can't I buy expensive aspirin? In many cases, by the way, there may be a massive mistake in that all scientists try and make medicine as easy as possible to take, whereas the placebo effect might be actually magnified if you had to go through a bit of a ritual.